So here we go, part 2. What makes healthy breathing? Well, it's all about the control pause. This is a Buteyko concept, the Russian physician. Basically, if you have difficulty breathing, then you also have difficulty holding your breath. Now, most of us are able to just simply stop breathing, hold our breath relatively comfortably for about 20 to 40 seconds. But really, and most of us are in that category, really very healthy breathing, you can hold your breath up to a minute and then just simply resume breathing without any difficulty, and that is a very healthy person. What the Buteyko concept is about, and I am a bit here too, is really trying to raise your CO2 tolerance so that you lengthen your control pause. That also has a lovely beneficial effect of making you calmer and less depressed and all those other things that we've just been talking about, less stressed. So, tricks to better breathing. One of the main cues to follow in trying to breathe better is to simply delay for a moment or two only, and I never like to say how long, that next in-breath. Close your mouth, obviously. The breathing should be noiseless. It shouldn't be huffing and puffing. Feel that you're not gulping in the air, that you are simply siphoning it in, and feel that you are taking the air right to the base of the lungs on either side. Remember, they sit down on your waist. And even try and underbreathe, creating a slight air hunger. Now, when you first do this, and funnily enough, I can feel myself gulping and huffing and puffing as I speak to you now, you will feel uncomfortable trying to actually underbreathe. It's a matter of getting your brain used to that higher concentration of CO2, and when it does get used to it, then you will breathe at a better rate and you will be healthier. But again, back to the tricks of breathing. Keeping the shoulders down and keeping your neck long. As you breathe in, feel your belly expand, because that's happening because your diaphragm is descending into your abdominal space and pushing out your abdominal contents, so that you actually feel as if you're breathing into your belly. Of course you're not. You're breathing into your lungs, but you feel it mostly in the belly. Some people say too that it's better to transversely breathe rather than vertically breathe, so that you actually feel your lungs expanding out to the side. And again, deliberately delay that next in-breath. Interestingly enough, there's lots of talk about body language with all sorts of psychologists. I actually think that these are two very interesting postures, and they actually make it easier to breathe well. Now, when you're relaxing, you often go to put your hands behind your head and lean back. That actually facilitates the diaphragm kicking in more, because it disenhances, if you like, or disables the muscles of your neck. By you taking your arms up behind your head, you're putting your neck muscles into what we call a shortened position, and they can't work as well, so your diaphragm has to work, which is why it's relaxing. And for totally different reasons, that posture on the right here also is relaxing, because what it does is that it actually creates a pressure on the tummy. Now, the diaphragm is a muscle, and like any other muscle, it works best with slight resistance. So with your arms folded on your belly, you create a resistance for the diaphragm to push against. The diaphragm works better, so you get a better quality of breath, and that's why that's relaxing. It also helps to let the shoulders down, which also disables the neck. You can train your body to accept more CO2 by breathing through one nostril now, especially if you're able to really calm yourself down and slow yourself down, and you can do it almost like a meditative thing. And you can potentiate the efficacy of that by actually doing it when you're walking, keeping your breath under control and not starting to speed up and panic. You'll notice all sorts of short-term and long-term effects if you're thoughtful and looking for it, but most important of all is you will find a newfound sense of calm almost immediately. The breathing will be easier, the coughing will be looser, and you often feel a sort of almost a deliberate popping noise as the nasal passages unblock. The body temperature rises because the circulation starts to work, because you're not anxious. The circulation is, you're no longer in fight mode. So the circulation is being diverted away from the muscles and back to the essential functions. You'll notice saliva returning to your mouth for the opposite reasons that I talked about earlier. You'll also feel that your head is clearing, and you'll actually sense, when you're calmer, that sense of smell will be more acute. Longer term, there will be more obvious effects too, often that you can't pick up yourself, such as blood pressure. But there are very obvious ones like more optimistic, less anxious, not struggling to breathe and gasping the whole time, not going to use your puffer, constipation, all the pipes inside are working better, but all sorts of other things to do with blood acidity, which take a while to settle down, such as arthritis and allergies, but they are going to be a long-term, steady, beneficial effect of simply calming down your breathing. And taping the mouth is a very effective way of trying to retrain yourself to not breathe through your mouth overnight and not to snore. Very much better option than those awful positive pressure machines which are so intrusive. This is really not the answer, these great huge bits of tape, because it rips the skin off, and if you live in Australia as I do, you'll get sun cancers on the top lip from taking off too much skin. So micropore is much narrower. Narrow micropore is the best. But we've seen some quite good studies with elite athletes trying to retain more CO2 when they're training, which sheds more hemoglobin, gives better tissue oxygenation, makes them perform better, makes them run faster, what you name it, row faster, whatever it is. And just as a final thing, breathing into a brown paper bag, one of the oldest wives' tales of all to deal with panic attacks. Now you know why that works, because you're rebreathing the CO2, you're rebreathing your stale air basically here, and this has a calming effect, and this gets you over your panic attack. So there we go.